Doctor, thank you. Based on the data released by Pfizer, does it seem realistic to you that younger kids will be getting vaccinated by Halloween?
It does, Shepard. It is going to be a thorough process at the FDA. They look at all the actual data, replicate the studies that are reported, but those findings are very promising, especially around the ability of a very small dose to lead to a very strong immune reaction. And that's another reason why we give a lot of vaccines to younger kids, very resilient immune system. So it's good that that's panning out, and action by the FDA in a month seems very feasible.
Man, this vaccine available to millions and millions more people, that gets us to a higher percentage. Big picture, what could this mean for the overall fight?
Well, as Meg said earlier, and as you said earlier, very high rates of cases among children now, with kids going back to school and our evenness of containing outbreaks in schools just not there across the country. There are some questions about how much parents will support use of the vaccines in their kids. We're up to about 55% of kids age 12 to 17 now, 12 to 16 now. So it could be higher numbers than the polls are suggesting, but it will make a big difference in keeping schools safer and preventing the kinds of spread that we're seeing now.
You got to hope, because the vast majority of those kids have to be vaccinated for a lot of stuff we have for decades and decades. Now, all of a sudden, politics.
Well, this one is probably not going to be a requirement anytime soon. It's still an emergency authorization. We still want to get a lot more data from lots of kids who are going to get these shots, not only here in the U.S., but elsewhere in the world as well, and see if there are any kind of rare side effects. But again, so far, the data looks very, very promising.
Fantastic. Dr. Fauci suggested today, I'm sure you heard, that Moderna and J&J boosters may be ready within 2 to 3 weeks, even though there really isn't a timeline yet for the FDA to review those shots. Do you support vulnerable Americans who receive those 2 vaccines getting boosters as soon as possible, or when?
Shepard, for vulnerable Americans, 6 months after the initial doses of the vaccine looks like a reasonable time frame based on what we've seen so far. Both J&J and Moderna have submitted data to the FDA. They did that more recently than Pfizer. So you expect something like the decision process that FDA went through with the Pfizer vaccine boosters last week to happen for those vaccines in a few weeks. I would emphasize that the FDA review committee unanimously supported use of boosters soon, or now, in not only people over 65, but a broad group of people who are at high risk, including people who are obese, people who have a serious health condition. And they also spoke positively about the use of boosters soon or right away in people who are frontline workers. So teachers, healthcare workers, other people who are likely to be exposed to COVID or likely to transmit it to others because of their living conditions. So that's actually a lot of Americans.
You know, I was looking at the overall chart of cases today, and I saw it do that just a little bit. It looks like maybe it's coming down. Is there a possibility in your mind that the feared fall surge might not happen?
Well, we are at very high levels of immunity in many parts of the country due to a combination of the levels of vaccination getting up there. We're at close to 3/4 of adults having at least 1 shot, and well over half of Americans with 2 shots, approaching 60%. And in some areas of the country, that's higher. We've had a lot of cases, thanks to Delta, creating more immunity as well. And if you look at some of the hardest hit areas of the country, Shep, including parts of the South, Louisiana, et cetera, the case rates have come down. We still have lots of people hospitalized, still seeing lots of deaths. Those unfortunate lagging indicators are going to persist for a while longer. But it is possible, especially if we can keep getting vaccination rates up, including among kids, we can keep from having another wave like the Delta wave this past month.
That'd be nice. Dr. Mark McClellan.